So here I'm going to show you a technique for the tibialis anterior in this prone position. This is a great position to work the tibia actually. I really enjoy this technique. The great thing about this position, it allows us to manipulate the ankle pretty easily. So it allows us to shorten and lengthen in the tibia as we work. So the first thing we do, we're going to find the shin with the knuckles here. So the first couple of techniques, I use the shin as my guide. So I'm just going to be starting close to the ankle and I'm just gliding down and I'm just using the shin so my knuckle is against the shin, so that keeps me on the meat of the tibialis anterior. And I work all the way down to the upper portion of the tibia at the knee and the superior tib fib joint here. So I hook, and I'm using my thumb, this thumb, to stay connected to the shin. Just slide down. So we can use knuckles like so. We can put the tibia on a stretch. So here I'm plantar flexing, pointing Kiki's foot. So most people have weakness in the tibia and they have issues shortening the muscle due to lack of range of motion in the talocalcaneal joint and the talocrural joint, the ankle joint. So most people are very weak in this area and actually have issues making the muscle shorten. So us as massage therapists, we're always trying to lengthen tissues, which is great, but sometimes we need to facilitate shortening. So to facilitate shortening, I would dorsiflex Kiki's ankle as I move towards her knee here. We can make it more active. So now I'm going to have Kiki plantar and dorsiflex her foot. And we move nice and slow. If your client's experiencing knee pain during this technique, you may have to go to a side lying or supine and or reduce the amount of knee bend. So if Kiki was experiencing, say, knee pain here or pressure, I would come into this position and do the technique from this position. But if they have full range here and they're comfortable, it's a double whammy, right? We're getting a bit of a quad stretch, we're getting a tibia stretch, we're getting tibia shortening. We can work this way too. So I'm going to use my fingertips. So I use these 3 fingers and I pull the middle one back. I've got a long middle finger. So I'm going to be here. I'm really hooking in this retinaculum initially, shorten the tissue and extend down, nice and slow. So my angle of pressure is always slightly oblique. As I feel, okay. We can use thumb, using ischemic pressure here. Not my favourite way to treat. It's a good way to assess tissue texture, movement. But it does get a bit labour intensive. But I know some people use a lot of thumbs, I know some people never use thumbs. I'm in the in-between camp. This allows us to really apply a lateral pressure. See, my pressure is going this way, I'm applying a lateral shear across the tibia. I like to use elbows here as well. for camera purposes, I'm going to be here, and I'll hook the leg like so, and I'm going to apply on the side elbow, and I'm going to use my elbow this way, and now I can move Kiki's hip into internal external rotation. That allows me to hit different spots. I can plantar dorsiflex, and I can also tibial external rotation and internal rotation. The knee actually affords a fair bit amount of rotation when the knee is bent. So in this position, obviously the knee is very bent, right? I can apply some tibial torque, internal and external. I keep my back flat, I keep my weight against the table, and I'm leaning into Kiki's tibian. Notice my elbow is about 90 degrees. We're working on a very small muscle here. So very rarely I'll come in here and really get a real steep angle. This is a very deep pressure. It can be done, of course, but when you're applying this steep angle of the elbow, the movement's very slow. So tibian prone is a great way to, if you're doing just a quick session and you're doing hamstring work, you're doing glute work, lower back work, you can really easily just add in some tibian work here, and it's very beneficial for our clients who are experiencing dorsiflexion restriction, which is probably 90% of our people, to be honest. Those clients are having sort of shin splint type issues, impingement in the anterior ankle, adding some tibian work, and you'll see it really improves ankle range of motion and gait issues, gait related problems. People have altered gait patterns from poor joint mechanics in the ankle. They always have trigger points and or shortness or weakness in the tibian. You'll find a lot of trigger points in the tibian, especially when you're working deep and you might be into a bit of the extensors digitorum. You'll find a lot of foot and ankle trigger points there. So a great technique to add in. I love this technique. It's actually one of my favorites.